Muy buen día, ¿qué tal? Mi nombre es Brian Mariños, yo soy nutricionista clínico y hoy le damos bienvenida a nuestro séptimo conversatorio. Hoy vamos a hablar sobre la nutrición clínica en la cirrosis hepática. Y para esto hemos invitado a uno de los nutricionistas que pues se ha tomado el tiempo de poder ayudarnos con este tópico, ¿sí? Joe Alvarez, él es dietista que trabaja en atención primaria en el Servicio Nacional de Salud de Londres. Además, tiene un diploma de nutrición y dietética por la Universidad de Chester y bachiller de nutrición por la Universidad de Nottingham. Él tiene una clínica privada especializada en gastroenterología y es miembro del grupo de especialistas de gastroenterología de la Asociación Británica de Dietistas. Además, cuenta con una maestría en nutrición y dietética en el área del síndrome de intestino corto. ¿Cómo estás, Joe? ¿Cómo te va?
Muy bien, muchas gracias.
Hello.
Hello.
So we're going to start this right away with one question. How would you define liver cirrhosis and what are the challenges for the patient and dietitians?
First of all, thank you for the introduction and nice to be speaking to you today. So liver cirrhosis is the scarring of the liver. It's damage to the liver and it's irreversible damage to the liver. So it's kind of the last stage of damage to the liver. So there's nothing we can do at that point to reverse that scarring. So really we need to take a step back and think about, you know, the steps before cirrhosis. So the first step being that fatty liver, which we're seeing more and more of nowadays with kind of increasing rates of obesity, diabetes, hypertension. We will see more and more patients with a fatty liver, but it's not necessarily causing them a problem at that first stage with the fatty liver. They won't be experiencing symptoms. The only time it might get picked up is if, you know, they have other investigations and potentially it will get picked up there. But at that point, there's a lot of things that people can do to reverse it. Then the next stage is when the liver starts to become inflamed, so the inflammation in the liver. And again, if that carries on, that can progress to fibrosis. You know, so that's causing some damage, but still at this point, reversible. But again, if that carries on, you get this irreversible damage, which could cause cirrhosis. In terms of challenges for the patient and dietitians, I think the general public, so most people don't fully understand or have a basic understanding of what the liver is and how much it does in the body. I think a lot of people understand a little bit more about heart health, for example. They understand a little bit about maybe why it's important to look after their heart and the importance of that. But they don't really have an understanding of what the liver is and what it does. So I think the first challenge is education and educating our patients on what our liver is, how it works normally, and how important it is to look after the liver. So there's that communication that's so important between ourselves and our patients. Obviously, that presents a challenge for the patient as well, because it can be quite difficult to understand these processes if you don't have a background in science or health. You know, it's quite difficult. So as dietitians, we need to be really careful in the language that we're using. We need to maybe use different resources to help educate our patients so we can explain it to them in clinic. But often people go away and they might not remember, or they might not have taken all of that information in. So maybe we can direct them to some further reading, further information, and thinking about maybe videos or some ways that people can learn about this to understand it. I think, you know, in terms of challenges, we'll speak more about this later, but in terms of obviously helping people to understand why they need to make changes to, say, their diet or their lifestyle, and the importance of doing that in terms of the kind of future prognosis and their future health.
That's very interesting and really, I mean, really key what you are saying. I mean, we need to stop assuming that the patient knows about its illness and start educating. That's really great. And what is the role of dietitians regarding liver cirrhosis therapy?
So I think, again, going back to what I was saying, I think that education is so important. And as dietitians, certainly here in the UK, we tend to have a little bit more time with patients than, say, the doctor who has diagnosed them will have with the patient. Therefore, we have that unique space and time where we can actually spend part of our consultation educating the patient on the liver. As I was saying before, what the liver does, how it works, and the importance of it. So I think our role in education is really important, not just with liver disease, but actually with other conditions as well. But, you know, specifically here, our role is in educating the patient around their diet and around their lifestyle and the changes that they can make. So in terms of cirrhosis, as I said, you know, it's irreversible. So there's nothing that they can do to kind of get rid of that scarring they already have. But what they can do is actually make some changes to help it progressing more and help it getting worse, stop it getting worse, which, you know, can obviously improve their health outcomes. So it's really, really key that we make that clear to the patient. Yes, the damage you have is there for life. However, if you can make some changes now, we can actually help to reduce the progression of this over time. So I really think with this, our role is around education. It's around listening to the patient, understanding what the patient already understands, understanding the patient's motivations. And again, we might touch on this later, but that's really, really important, because sometimes as dietitians and as health professionals, we think we know what's important for the patient. We think we understand what their priorities are, because we might think, well, of course you want to make these changes to kind of improve your health. You know, from our point of view, our agenda is to do that. But is that the patient's priority? You know, so understanding the patient's motivations and trying to help them see why it would be helpful for them to make changes. So that behavior change and using behavior change techniques is really important in this particularly. We may be seeing patients here with issues with alcohol excess. Yeah, because, you know, the main reasons that people will have liver disease, you know, the kind of three areas are excess alcohol intake, which over time damages the liver, and if they don't reduce or stop drinking alcohol, will lead to cirrhosis. The next one is non-alcoholic fatty liver disease, which is more related to obesity, type 2 diabetes, so more diet and lifestyle. And the final one is viral infection, which you know, is kind of not necessarily related to those other things. So you know, we need to remember the how they got here. Okay, so if we're dealing with a patient with alcohol excess, we need to understand that and understand the reasons maybe why they got there, and think about that when we're doing a plan for the patient as well.
Okay, so I think that it is really remarkable that, or thinking that going straight to the nutrition intervention is not the key. I mean, the key is to understand patient's background, yes, and use this macro process, which is education, to give sustainability then to our nutrition therapy. That's really interesting. But what are some key points a dietitian must be aware of when treating a patient suffering from liver disease or liver cirrhosis?
So I think, again, going back to what I was saying just now about remembering the causes for the liver cirrhosis. So if we have a patient in front of us who has a history of alcohol abuse or is still drinking excessive amounts of alcohol, it's really important that we take that into consideration, because ourselves as dietitians on our own, we are not going to be able to necessarily deal with that part of their lifestyle. So we need to bear that in mind. That doesn't mean we can't talk about it with the patient. That doesn't mean we can't open that discussion with the patient. But we have to remember that, you know, we can't do everything here. But who can help? So, you know, are they getting maybe help from psychology teams, or are they getting help? You know, in the UK, there's certain charities, you know, or organisations that can be really helpful in helping people to rehabilitate. You know, so thinking about that in your mind as well, you know, and I think it depends on where you're seeing the patient as well. So are you seeing them in the hospital, or are you seeing them once they're out of the hospital? So if you're seeing them in the hospital, your priorities might be slightly different to obviously when they're out of the hospital. So you want to be thinking about this patient's lifestyle. Where do they live? Who do they live with? What facilities do they have available to them? So those social aspects are so important. Because again, our agenda might, you know, we might be thinking, okay, there's all of these things that they can do, but actually, is it realistic for that person to make those changes? You know, do they have the access to the food that we're recommending? Do they have access to prepare the food? Do they have financial means to do that? So that's really, really important. Also, you know, we're just looking at liver cirrhosis, but these patients, you know, often will have other conditions. So we might be thinking about type 2 diabetes in a lot of these patients, hypertension, high cholesterol, obesity, maybe kidney issues, you know, other things as well that might be going on. So it's really important to remember those aspects as well in our assessment, and thinking about what the priority is. That's the kind of thinking about the kind of maybe alcohol excess side of things. If we're thinking more about the non-alcoholic fatty liver disease, we're probably in front of us, we probably have a patient with obesity, usually. That's not everyone, but often, you know, the risk of fatty liver disease increases with obesity. So we need to then think about it from that angle as well. So I think there's some really key points. We need to think about whether they have decompensated or compensated liver disease. So if they have compensated liver disease, the liver is still working, it's still functioning, okay? If they have decompensated liver disease, it's not working in the same way. So we need to remember that as well, but not all of these patients are the same. Yes. So it's really, really key to be, you know, take an individualized approach as well.
That's great what you said. First, the dietitian must have the personality to work with a team and as a team, and also to apply the nutrition care process to individualize the therapy. I mean, to evaluate the patient so you can gather information just from the patient, this patient, I mean, from this individual, and then to diagnose, to intervene, and then to monitor. That's interesting, absolutely. And what is your opinion on the use of special enteral formulation in these patients? Because, you know, some guidelines and, you know, laboratories also give you information about that to use or not to use certain kind of protein or certain kind of amino acids and stuff like that.
So I think, again, it's going back and thinking about the patient that you have in front of you. Do they have other things going on? You know, do they have diabetes? How well controlled is their diabetes? You know, and that might affect the supplement that we recommend to the patient. So I think it really depends on the patient that you have in front of you in this case. However, I think that in most cases, we don't need to use a special formulation for these patients. The priority when we're thinking about somebody with you know, end-stage liver disease, decompensated liver disease, so probably at risk of malnutrition, that's the patient, you know, a lot of these patients will be at a high risk of malnutrition because their liver is no longer functioning. Therefore, you know, it's not storing the glycogen, and so their nutritional requirements will be increased. You will see patients who are, as I said, probably overweight or obese, but are at risk of malnutrition because of their increased requirements. Therefore, we will be seeing here, you know, increased protein requirements specifically. So it's really important to look at your patients as well. Look at their arms, you know, look at their legs. Do they have slim arms? You know, ask them that as well and say, you know, have you noticed that you've had a decrease in your muscle mass? So that's really important, really, to think about protein, I think. So I think in most cases, we don't need to be using special formulations. But it really does depend on the patient that you have in front of you. Most of the time, we're going to be looking at protein and, you know, carbohydrates. So we recommend a 50-gram carbohydrate snack before bed for patients with decompensated liver disease, again, because they don't have those glycogen stores in their liver. So in that case, if we're going to be using a nutritional supplement to provide that carbohydrate, then we need to be looking, you know, for the right one that does contain 50 grams of carbohydrates. But often, you know, we'll be looking at getting that from food first of all. So.
Great. So as I think we can see is that there is no need for a special enteral formulation. What we need to be worried about is just the nutrition sufficiency, yes, for patients to meet their needs. Muy bien.
Absolutely.
So what different strategies can enhance adherence to nutrition therapy in this subject?
So I think I touched on this a little bit earlier about motivation. I think we need to be understanding, and again, not necessarily just for these patients, but we need to be thinking about the motivation. So when I say motivation, I mean first of all, how they got there in the first place. So again, is this an alcohol issue? Is this a lifestyle kind of obesity issue? Or, you know, those are kind of the main ones usually. So we need to understand that. Then we need to understand what their goal is and what their priority is, as I spoke about earlier. What do they want? And that's really, really important because they often, you know, we have a bit of a top-down approach in a healthcare system. So I'm the health professional. I'm going to tell you what to do, and you're going to go away and do it. But actually, we need to be thinking about what do the patient want? What does the patient want? And actually, if we do that and we hear that, the advice that we give them, you know, they're going to be more perceptive to the advice that we give them, because then we can think, okay, that's your priority, so I'm going to work with you on that. So that's really important. So using some motivational interviewing techniques. So for example, how important is it to you to make changes to prevent further damage to your liver? How important is that to you? You know, and asking them to rate it on a scale from 0 to 10. And if they give you a low score, if they say 3, it's not very important. Then asking why did you give me 3? What? Explain that. And once the patient has explained it to you, you can then say, how can we make that? How can we get that number higher? What would get that number higher for you? So really getting them to think about, you know, this and getting them to understand the importance of it, but not just assuming that this is really important to them and that they're going to take on all the changes that we recommend. Also understanding the patient who you have in front of you, again, so their lifestyle, their family. So, you know, we have, you know, and I'm sure everyone would agree with this, you might have patients come in who say, my motivation is my family, you know, because I have children or I have grandchildren and I want to live, to, you know, I want to be here to see them, I want to see them get married and, you know, do those nice things. So that might be their motivation. It might be something else, you know, it might be, you know, I want to travel, you know, I want to do this or whatever. So understanding what's important to the patient. Once you've got that understanding, you can say, in order to do that, these are the things that you need to do to get there. So I think that's really important in terms of the adherence. We also need to be realistic with these patients. So going back to what I was saying about, you know, some of these patients might have a history of alcohol excess or alcohol abuse. Is it realistic to say to them, you know, never drink alcohol again? Obviously, that would be the best thing for them, but we have to be realistic with our recommendations. And again, discussing with the patient, trying to get them to understand why that would be important. But also always in the back of my mind thinking, what is a realistic goal for you moving forward is I think is really important. And I think that helps with adherence, because if we can say, you know, this is your goal, starting with something small rather than saying, you know, this is your goal, a huge goal that's going to be kind of overwhelming and seem unachievable at the time.
Lovely. Thank you so much. I think we reached to the end of this conversatorio. So, quiero agradecer a todos los que han llegado hasta aquí. De verdad que ha sido bastante enlightening este conversatorio con Joe Alvarez. Él habla un poquito de español, ¿verdad?
Sí, hablo español. Muchísimas gracias.
Muy bien, muy bien. Igual vamos a tener a Joe Alvarez en el Congreso de la Asociación de Nutricionistas Clínicos a celebrarse en la primera semana de diciembre, así que estén atentos. Igual nos vemos en el siguiente conversatorio. Un abrazo a todos. Muchas gracias, Joe.
Adiós, muchas gracias. Tengo ganas de veros otra vez.
Muy bien, nos vemos.